Before I was diagnosed with cardiomyopathy, we lived in Indianapolis in a very small town, and I was having heart palpitations. I was walking about 5 miles a day because I was doing visual merchandising for a large store there. So I was up and down ladders and moving things around, and one day I just kind of started not feeling so well. And I went to the hospital in this small town, and they said, "Oh, you have an enlarged heart." Cardiomyopathy is it's when your heart is not functioning as well as the average person. After having cardiomyopathy and being diagnosed with diabetes, I had tried to change my life quite a bit, so I was doing better things. I had lost the weight, and I was on vacation in Cuba, and I had a bump that I had felt underneath my arm before we went to Cuba. So the following day we got back, and I had my diagnosis come back as stage 2 breast cancer. So I came to Rush. Here I am, and I love it. My team has been awesome from the very beginning. My care team at Rush consisted of Dr. Tochi, who is my cardiologist, and Dr. Perez, who is my breast cancer surgeon, and Dr. Kim, who is my radiologist.
Angela developed breast cancer a few years back. Prior to that, she had a history of heart failure already. She developed heart failure way back in 1998, so 20-something years ago, and the breast cancer was 20 years later. When people have breast cancer, especially the kind of breast cancer that she had, required chemotherapy, and the chemotherapy that she was going to receive for her breast cancer is what we call cardiotoxic. So it's technically kind of chemotherapy that can hurt the heart. And then, interestingly, just as she was getting her port placed in order for her to receive the chemotherapy that she was going to receive, she was noted to have what we call atrial fibrillation, which is an abnormal heart rhythm. It can make you form clots in the heart. And so that was another thing that added to what she had already. Other issues, she also had a history of diabetes, which increases the risk of heart disease. And she also had high blood pressure, which in the setting of the chemo she was about to receive, increased the risk of even further heart failure and heart problems. She also received care from electrophysiology, with cardiologists that take care of the electrical rhythm of the heart, so the defibrillator aspect of it, the surgeon that put in the ports, and then all the ancillary staff, the nurses, the infusion, especially the infusion nurses who were the ones infusing the chemotherapies that she received, and then the nurses in our cardiology clinic as well. It's definitely a group effort.
I always felt very comfortable coming in for my treatments once a week. Dr. Tochi, who is my cardiologist, was awesome as far as directing me on how I could keep my heart going and keeping things under control there. Always monitoring me and making sure that things were on track.
When there were issues going on with her heart, I had to be very frank about communicating with her oncologist so that we both knew what we were doing. And a couple of times, her heart failure got so bad that we had to stop treatment for like a month or two and then continue after that as well, because it was really necessary that she got the cure that she was seeking from her treatment, at the same time making sure that her heart was stable enough to take that treatment. So we knew her heart was going to take a hit in the process, but we had to figure out a way to manage her through that treatment to make sure that she safely got to the other end.
The cardiomyopathy was okay throughout my chemo treatment, but they still took very, very strict precautions to make sure my heart did not get any worse than it was. The breast cancer chemotherapy is very hard on all of the extremities. My kidneys suffered, my heart did suffer a little, but not bad. But through exercise and eating right and following all of my medications, I was able to come back.
Right now, Angela is doing very well. She sees me right now every 6 months. She's doing extremely well. She exercises regularly. She takes her medications regularly.
My care with Dr. Tochi is something else. She is definitely a pistol. I absolutely love her, but she is no nonsense. She takes no prisoners. I've always appreciated directness, and she is not short of that. There's so many people that have become so much more than just caretakers or nurses or doctors. People who I know, people who remember my face, people who remember my name. Eunice in the care center, the greeter, she knows about my mom. That's always just a special touch. Customer service is incomparable to any place I've been. Some places say that they're the #1 in care for cancer treatment. Rush is definitely #1 in my heart because I've gotten such amazing service from a great, amazing team of people who seem to always care.